ovulating, but they are not aware of it. And those that are not ovulating and they are aware of it. So we are going to be looking into this topic, getting pregnant with ovulation problem. And I know that 100, even 99 or 85% of women out there have this problem of ovulation problem. Some people are not ovulating. They are not even aware that they are not ovulating. While some are aware and they are looking for solution to their problem. So now, when you try to get pregnant with ovulation problem, now how would you know? Before we start talking about ovulation problem, how would somebody know? I'm sorry, I'm not going to be consistent because my kids are at home. So I may be going off and coming in. That is why I want to concentrate and talk fast before they will start their noise. So how would you even know? Please, I need your number. Okay, from Botswana. No wonder I couldn't pronounce it now, but my sister, you are highly welcome. Thank you so much. Somebody, Chizzy, say, I need your number. Chizzy, you can write me on Messenger now. If you can send me voice message, you can write me on Messenger. But I will check if you are following me. If you are not following me, I will not respond to you. Many people are writing me. When I check they are not following me, I don't respond to them. If I have not responded to you, it simply means that you didn't follow my page. So, now, how would you know if you have ovulation problem? Because sometimes you don't know. What you know is that you are not getting pregnant. How would somebody who is trying to conceive, who is trying to get pregnant, know that he is not ovulating? Now, the way you will know that you have ovulation problem is when your period is not regular. In normal circumstances, every woman is supposed to be menstruating every month. As long as you are ovulating, menstruating every month, there is tendency that you will ovulate. But in other way around, it's not every woman that menstruates ovulate. But these are the good signs that will tell you that at least you are ovulating. At least when your period comes regular every month, you will be hoping that you are ovulating. Now, when your period is irregular, when your period is not coming every month, that is when ovulation problems start. Because if you are not menstruating, there is nothing like ovulation. Because the phase one is menstruation. Then after menstruation, the follicle will start to develop, getting to rapture age or rapture time, which is ovulation. Then it will release the egg. But in a situation whereby you are not menstruating, the ovulation cannot come except when medically ovulation is being induced. That is why sometimes you see women above 50, 60 giving birth. Those women, they are not menstruating, but because of the inducement of the ovulation, they were able to conceive. So, number one way which you can know that you are not ovulation is when your menstruation is not regular. What I mean being regular is not that some people, when you talk about irregularity in menstruation, some people think that if they see their menstruation on the 28th of or 1st of this what month are we now? February, that they must see it first month, next month. No. Irregularity means that every month you see your bleeding. Every month you know that at least you don't have ovulation. Although you may have ovulation problem, but at least you'll be how will I put it? You'll be assuming that you are ovulating. This is number one. Number one way you can know if you have ovulation problem is when your menstruation is irregular. What I mean by irregular is that it doesn't come every month. It doesn't come. Maybe some people, they see their menstruation once in 3 months, once in 2 months. This is what I mean by being irregular. So the number two is how would you know now that you have ovulation problem? Your doctor can tell you that you are not ovulating after blood testing. Then sometimes when you are trying to conceive, if you meet specialists, fertility specialists, they will conduct a blood test, and during that the blood test, they will know whether you are ovulating or not. So I'm talking about now, what I'm talking about now is the way you can know whether you are ovulating or not. Please share this video. This is very, very important. Every woman out there need to watch this program. Share it to any platform. So I said, number one, I'm going to be repeating it because so that people who are joining us now will understand what we are saying. Number one way, and besides, the topic is how to get pregnant with ovulation problem. And we are talking about how would you know if you have ovulation problem. Number one, I talk about irregularity in your menstruation. When you are not menstruating every month, that simply tells you that you have ovulation problem, because you are, any month you did not menstruate is any month you did not ovulate. Any month you are not menstruating, you are not ovulating. Now, the second way in which you will know if you have ovulation problem is through test, blood test. Your doctor will conduct, or healthcare provider will conduct tests on you and tell you whether you are ovulating or not. The most common fixable ovulation problem are, now, these ones now, they are ovulation problem, but they can easily be fixed when the due process is being followed. One, when you have thyroid problem. I've been talking about this thyroid problem. If you have been following me, you see me talking about thyroid problem. Some people have what is called thyroid problem. And that thyroid problem is divided into two places. One is called hypothyroidism. The second one is hyperthyroidism. Hypothyroidism is when your thyroid gland, that is FSH, is low. When it's low, it slows down your system. And how would you know if you have this thyroid problem? One, thyroid problem will make your system to be slow. If you are always feeling weak, if you feel tiredness so fast, if you are fat and you have been on diet, trying to reduce, no matter how many exercise, the food, the diet you eat, you are not reducing. You always feel cold. These are the symptoms of hypothyroidism. Now, when it's hyperthyroidism, that is when this person chooses to say, I feel pregnant symptom, but suddenly my period came out. I follow my ovulation day. My cycle is Cheesy, please let me just finish this. Let me round this thing up. I will answer you. Please keep reminding me, because if I start answering your question, I will be distracted. I always give opportunity for question whenever I'm done with any topic. So hyperthyroidism is when your thyroid gland is acting so fast. So how does this thyroid gland relate or connect to ovulation? Thyroid gland always produce what is called FSH, which is responsible for triggering ovulation. It goes direct to the brain to remind the brain, hey, brain is just like an idiot. Brain is empty. Is this FSH that will go and trigger the brain? My friend, it's time for you to release something. So, in a situation whereby this thyroid gland is slow, then ovulation will not take place, because nothing will go and tell the brain to produce an egg. So this is why if you have hypothyroidism, your doctor can prescribe medication for you. If you take it faithfully within 6 months, it will be fixed. But if you are suffering from hypothyroidism, you might not be ovulating. Even if you are ovulating, the eggs that they are producing may be too weak. They will not be healthy enough for the sperm to fertilize it. I hope you guys are understanding. Please, if you don't understand, when I finish, ask me question, because this is very, very important. This topic is very, very important. So another way you can know if you have thyroid ovulation problem that can be fixed is a high level of prolactin. I have been talking and mentioning prolactin in all my videos. Now, somebody will say, what is prolactin? Prolactin is the hormone that is responsible for breast milk production. When a woman gives birth, the milk that is coming out is called prolactin. The prolactin is responsible. In most of the cases, you will see a woman that have not given birth and she's not pregnant, and you will see a breast milk coming out from your breast that is called prolactin. And when you are having this issue, you are not ovulating. You might be menstruating, but you may not be ovulating until that prolactin is being fixed. Now, prolactin is the hormone producing your pituitary gland. If you are not pregnant or breastfeeding, your prolactin should be low. It can prevent you from getting pregnant. If you are not pregnant, this prolactin increases when pregnancy occurs. That is why once you are pregnant, you will see your breast will be so tender, thick, heavy. That is, the prolactin is doing its work. It's producing the breast milk for the fetus, for the baby to take when the baby is delivered. But if you are not pregnant and you are seeing all these things, it means that your prolactin level is high and you need to take metformin. I don't want to prescribe. Go to your doctor. Your doctor will prefer or prescribe medication for you. Now, we have what is called insulin resistant. Many women with ovulation problem called Pcos. This is a very big problem that women out there suffers. Insulin resistance. Women with PCOS, they don't ovulate. If you are suffering PCOS, you are not ovulating. That is polycystic ovarian syndrome. Now, it is a type of hormonal disorder causing enlarged ovaries with small cysts on the outer edges. Women with PCOS usually do not ovulate because they resist to insulin. Now, this is the highest problem of infertility that is being caused by PCOS because of the insulin resistance. So women with PCOS, I have talked about PCOS. Maybe later you go through my page and you will watch it. And every month, maybe I'll be using the diagram to be explaining this. Every month, once a woman menstruate. So after your menstruation, which is the luteal phase, then the follicles, the second stage is that the follicles will start to develop in your ovary. Now, every month, every woman have two ovaries. Now, either you produce egg from one ovary or sometimes from two ovaries. That is when you will see an issue of twins. So in these follicles, after your menstruation, it will start to develop. Getting to the period of ovulation, then the egg will be released. But in the issue of those PCOS, the eggs will be there. They will be tiny eggs like this dot in your womb. They will be there. No one will mature. They will not grow. They will just be like that, and at towards the period of ovulation, they are not going to release. So that is what is called PCOS. Now, somebody who is suffering from PCOS, how can you handle this? Now, people with PCOS are always fat people. If you are fat, very, very fat, I think the suggestion that you can use to solve your problem is weight loss. You need to engage yourself in exercise, dietaries if you are inopportune, and sometimes your doctor may use Clomid. But in the issue of using Clomid, if you are not careful, you will cause another problem to yourself. Remember, you have unmatured follicles there. Now, if you should take Clomid on your own, the Clomid will not increase the number of follicles, causing more problems to your womb. So, if you are suffering from PCOS, do not go and take follicle without your doctor monitoring it. So, another thing, you should avoid dairy food like milk. Women with PCOS, they do not ovulate. Are you not listening to what Princess, I'm saying it. If you have PCOS, you don't ovulate. You don't ovulate. So, now, how can I get pregnant? I have talked about ovulating. Now, how can you get pregnant with ovulation problems? So, the first thing you need to do is to find out the type of ovulation problem you have. Do you have PCOS? Do you have thyroid problem? Do you have insulin resistance? If you have all this problem, they have solution. There is no problem in this world that do not have solution. Don't let anybody deceive you. In Nigeria, sometimes when you have PCOS, the doctor will tell you your womb is spoiled, that you cannot get pregnant again. It's a lie. So, I don't know where I stopped now. If I read your question, it gets me confused. So what you need to do is to find out the type of ovulation problem you have. And I want to tell you people out there the truth. I will not deceive you. If you are a TTC mother, somebody asked me what is TTC. TTC simply means trying to conceive mothers. You need to be prayerful, especially those of us in Nigeria. You need to be prayerful. Do you know that God answers prayer? I am not preaching, but I'm telling you the truth. If you can bet it now, you want to conceive next 2 months, use this month and next month, go to God in prayer. If you are a Muslim, pray to Allah. If you are a Christian, pray to God. I didn't say you should go to church and pray. No, at your home, even when you are walking on the way, tell God that this year I want this. This year I want baby girl. This year I want baby boy. This year I want twins. This year, as you are saying it, have faith. Faith. You people go to church. Faith without work is dead. When you ask God for something, believe it. I was reading Bible on Sunday. I came across a chapter in the book of Matthew where Jesus Christ was telling his followers that if you have faith as little as mustard seed, that you can move mountain. If you ask God for a baby, despite the fact that maybe your doctor have tell you, they are always so good in telling you that you cannot do this thing, it's impossible, is that, tell them that with God, all things are possible. Pray to God. Cry to God. Those cry, you cry to your friends they will be laughing at you behind. Those cries you cry to doctors that they are not providing solution to you. Why not ask God? Why not ask Allah? Anything you believe in, ask God. God answers prayer. God is the giver of every children. You do the ones you can, like all these things I said. That is why I said you should go for hormonal test. Check every of your hormone. If they are good and yet you are not conceiving, it is called what is called undescribed infertility. Some people are not fertile. Some people are not fertile. It's not because they have problem. That is called unexplained infertility, which means only God has solution to that. And when doctors find out, if you have been going to the hospital, doctor tells you everything is good, yet you are not conceived, it is called unexplained infertility. And your doctor will always prefer you to IVF. If you have money, you can undergo the IVF, but if you don't, ask God. God is the final say. He has the final say. I am telling you people, I am a living witness to this. Pray to God. Pray to God. Do not ask your pastor to pray for you. Because those people you're asking to pray for you, they have their own problems. They are human beings like you. Nobody in this world that do not have problem. Sometimes when you say pray for me, I always laugh. Because the person you are asking to pray have their own problem. Have they finished praying for themselves? Some of the churches you go, they pray. They have not even finished solving their own problems. You can pray. God is everywhere. God is in your heart. God is in everything. Ask God to give you a child. Ask God, take your prenatal vitamins. Ask God, bless me. Can you people remember the story of Hannah? I am not preaching to you. I am encouraging somebody out there because I have lived with people who are trying to conceive. I know the depression. I know the sadness. I know the stigma, especially in Africa. I know everything. Do you know this story of Hannah in the Bible? Did she go to pastor to pray for her? No, she went to the house of God. She cried to God. And what did God do? God answered her. My dear sister, you are watching me. I don't know you. You don't know me. I am telling you the truth. Go to God in prayer. Do the necessary things and see God in action. When you ask God, have faith. Faith conquers all. In anything you do. That was why I posted a video. I said, in any situation you see yourself, say, God, thank you. Thank you. I am happy that I have not conceived up to this moment. It is your grace. God, I need your grace. Don't say, God, oh God, why am I not getting pregnant? You start competing yourself, comparing yourself with others. That is why, as you see me, if you like, have everything on this world. If you like, be a trillionaire. It doesn't move me. I don't wish to be like anybody. If you like, be whatever you think you are. I don't want to be like you. I want to be like myself. Stop comparing yourself to anybody. My mate, my schoolmate, she's married now. She have 3 kids. While me, I've been married since the last 2 years. Do you remember those that have died? Do you also remember that there are your mates that have died? This is the question you should ask yourself. Stop comparing yourself. Stop wishing to be like others because you don't know what they passed through. For the fact that they are putting on good clothes, making mad, making unnecessary noise, you think it's well with them. Oh no, go to their house. You will see that you yourself, you have happiness more than them. Yes, I need to say this because I receive a lot of calls. People will be crying. My sister, I don't know what is wrong with me. They have bewitched me. I am not getting pregnant. You will get pregnant. You are the one that is holding yourself. You are not releasing yourself. Don't kill yourself with depression. Don't kill yourself about what people say. Don't listen to what people say. Listen to your heart. Follow your heart. Pray to God. If you don't know how to calculate your ovulation, ask anybody. Ask me. I will help you to calculate it. Prayer. 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 Prayer works miraculously. I want to encourage somebody out there. Stop crying. Stop comparing yourself with another person. My classmate, she have 4 kids. I am married. No child. No child to call my own. I want to go and adopt. I want to go and do this. Why would you do that? So it seems I am going into Bible. I just tell you the truth. With God, all things are possible. God has the final say in everything we do. Do not wish to be like other people. Wish to be yourself. Do not compare yourself with others. If you see good thing that happens to somebody, what you should do, God bless me the way you bless this person. And don't be envy about other people's progress because envy is the highest witchcraft. Enviness block your way. When you are envy about others, you will never move forward. Rather rejoice with them. If you rejoice with them with an open heart, whatever you ask God, He will do it for you. Whatever you lay your hands will prosper. But as long as that envy and jealousy is there, you are not going anywhere. I am telling you. Well, for say, let's proceed, please. Where are you proceeding to? I have finished teaching my topic. Now, I want question. Somebody is coming to me. I'm not going to waste time now. If you have any question, ask me. Okay, Wow, good Chichi. Chichi, take time. Which one is less proceed? So all this thing I'm saying is nonsense. So ask me question now. Ma, I have been menstruating since last week. It lasted for 6 days. 6 days is not too much. Sometimes it may last. When you will start counting that you are menstruating is when you see the real blood. Some people, when they want to menstruate, the first time they will see something like dark brown or spotting the first day. Then the second day, the main bleeding will start. So, it's normal. When you see 7, 8 days, then you will know that there is problem. I have fibroid and blocked tubes. Ifeoluwa, you were the one that said that your fibroid is I think 5 centimeters long, right? And blocked tube. Ifeoluwa, is the tubes, are the 2 tubes, are they blocked? You have 2 tubes. If one is blocked, you can still get pregnant with one. The problem comes when the 2 tubes are blocked. Is the 2 tubes blocked? Immediately after my ovulation, my breasts become heavy and crampy until my next period comes and it stops. What is the cause? Who is this? One go Chichi. Chichi, maybe you haven't watched the video I made about signs of ovulation. Some women, when they want to ovulate, they have what is called breast tenderness. Your breast will be tender. And after the ovulation, it will release. Again, it comes when you want to menstruate. It happens like that. But if after your ovulation, because after your ovulation, see how this thing works, after your menstruation, then the follicle will start growing. Then when ovulation is reaching, the egg will be released. So after this ovulation now, it will take the egg. It will take the egg. Now the egg will be released. After the egg release, it will be in your womb waiting for the sperm to fertilize it. It will be there like 3 to 4 days. Now, if the egg is being fertilized, then it will travel down to your fallopian tube. To start from day 5 to travel down to your fallopian tubes. So when it's traveling to your fallopian tubes, that and it will implant. If it implants successfully, you may experience breast tenderness, light spotting. So it's something that will come like your period. You may have the symptom of your. I beg, if I miss your question, you will ask it again, because many questions I'm done talking. So when the implantation is successful, you may experience a spot blood like pinkish, and it doesn't last some 2 hours a day. Then you know that you are pregnant. Then you can start having all these things you are talking about. Yes, I saw black period before the. Yes, you see, you don't have problem. Yes, ma, bilateral tube blockage. Ifeoluwa, I think you should visit your doctor. He will provide a solution, because you have 2 serious case there. I had a very serious pain at the left side of my ovaries around the 13 to 14. Could this be the sign of course, yes. Yes, these are the sign of ovulation, depending when the pains last. If the pain lasts more than a day, then it's not longer ovulation sign. Have been running temperature and severe pelvic pain during my menstruation. Ifeoluwa, you will experience it because of the fibroid. Your fibroid is very big. It can cause you to have a severe pain during your menstruation. It can cause you to have a heavy menstruation. So you need doctor. You need doctor to monitor you, to watch you. After you may be doing those things I said about how to unblock tubes. You may be doing it, but this case is very big. It's more than 5. You need doctor's attention. So your doctor will check the tubes and tell you what next to do. What is the time now? So I don't know if anybody have question. Mine is just severe breast pain, tenderness 2 days after ovulation until my next period. I always check, but no pregnancy. It's not immediately after. Didn't you understand? Cheesy queen. Cheesy, you didn't understand what I'm saying. When after ovulation is not when the conception take place already. Conception take place 12 to 7 days after your ovulation. That is when, if the egg implants successfully, it's possible that you ovulate, and it's possible also that the sperm fertilizes the